Hi, Paul Chakin again, ultrasound director at St. Mary's Mercy Hospital in Livonia. Today we're going to briefly talk about measuring bladder volume. This has been a question that frequently comes up, and hopefully this very short tutorial will be helpful. If we focus our attention to the ultrasound machine right now, you can see that right now we are scanning through the bladder in short axis. What we want to do is find the bladder in its widest, in its largest diameter, and freeze the study. Once we have the study frozen, what we will do is click the measure button because we're doing a calculation. Right now, we are on the fast preset, so bladder volume does not automatically come up. But you can see that bladder is one of the options. If I select bladder, you can see that I have multiple settings. There's pre and post bladder length, height, and width. For our purposes making one measurement, it does not matter if we select pre or post. This is just for labeling if you're doing this at the level of a tech. Right now, the bladder length is automatically selected. What is labeled length, height, or width for our purposes doesn't matter, as it doesn't affect the calculation. So I start by measuring the bladder from left to right. I move it to the largest area, I press the click button, and then I move it over to the other side, and I press the click button again. Now you see that there is a check mark by the first measurement, and it automatically defaults to the second measurement. I will again move the cursor and measure it now from top to bottom. And you could be generous in your measurements, as this often undermeasures. Now you could see there's a check mark by the second measurement, and it defaults to the third. Looking at the screen, if you could picture the transducer on the patient's body, the indicator is oriented towards the patient's right side. So the probe is oriented left to right on the patient. That means that this measurement is the patient left to right. This top-down measurement is what's closest to the probe to what's furthest from the probe. This means it's measuring from the patient's stomach to the patient's back. So this is the width of the bladder, and this is the depth. For our third measurement, we need the length of the bladder, or the measurement from head to toe of the bladder. To do this, we have to unfreeze the image, and we have to get the measurement from the patient's head to toe. What we then need to do is rotate the actual probe so that the probe marker is towards the patient's head. And then we scan through the bladder in long axis. When we identify the bladder in its widest, we again press freeze. When we go back to the measure setting, you will see that the first two measurements we made are still saved, as you see the check mark by both of them. And the last measurement is highlighted. When we do this, we again measure left to right on the screen. This is because as the probe is oriented towards the patient's head, left to right on the screen is measuring towards and away from the transducer, and the transducer is towards the head. So this measurement is now the measurement from head to toe, or the bladder length. If we measured from top to bottom, this would still be what's closest to the transducer to what's furthest to the transducer. So this is still the measurement from stomach to back, or the depth of the bladder. So therefore, this is the third measurement. Now that we made the third measurement, we could see that the volume says 55.73 mLs. This is the measurement of the bladder. If you press save, it'll save this still image with the measurement to the patient. And then if you press end exam, it will send that exam to QPath. Now note, if we are in the renal preset when doing measurements, when you click measure, it'll automatically default to the bladder measurements. This was different than in the fast setting when we had to select bladder, but the actual measurements are the same. To show you the difference one more time, if we're in the renal bladder preset and we press measure, it automatically defaults to bladder volume. If we're on a different setting such as fast exam and we press measure, we have to select bladder. And then we have the same measurements. If you have any questions, please feel free to contact me.